Thank you very much. Sorry about that. Okay, this next session is going to help paint the picture of what a consumerized healthcare world looks like. I'd like to invite our next speakers to the stage and introduce you to Rob Flippo, the CEO of Mobile Health. Come on up, everybody, who will be leading this presentation. Thank you.
I'm Rob Flippo. I'm the CEO of Mobile Health, and I definitely want to thank you for spending some time with us here today, especially it's really close to lunch, and I know that's a challenge to get through material without losing people. But at CES, we're hearing a lot these days about how consumers are changing and transforming healthcare, and that that we're on the edge of a massive change in the way healthcare is delivered. So we think this represents a great opportunity for a win-win-win situation where patients win, providers win, and the often forgotten caregivers also win. So how do we know we're on this threshold of change? Well, for one thing, the largest retailers in the world, Best Buy, Walmart, Amazon, CVS, they're all talking about this, and they're all making investments in this world and in these changes. So they have giant consumer bases who represent large portions of our population, and they have their fingers on the pulse of what these consumers want. So why do they want to get into healthcare? Well, they're betting on what healthcare providers have known for a very long time, and that is that the best place to care for patients, especially patients dealing with chronic conditions, is in their home. So they're banking on that and want to take advantage of that fact. So when we think about the fact that 75% of all healthcare expenses are related to dealing with chronic disease management, it represents a huge opportunity. So when we think about the technologies that are going to be important in this space, we think about 4 things that come to mind for me: remote patient monitoring, wearables, voice technology, and AI. And on the remote patient monitoring side, it was originally developed really to help rural patients stay connected with their doctors when it was difficult. But we're now seeing a huge increase in remote patient monitoring being used for chronic disease management, and there's 2 reasons for it. Number one, it's been proven to reduce hospital readmissions, and for chronic disease management, keep people out of the hospital. And number 2, there's a wave of legislation that's been passed to provide for additional reimbursement, which is really fueling the investments in the remote patient monitoring space. And when we think about the kinds of devices that'll be used in remote patient monitoring, wearables come to mind as a simple form of remote patient monitoring device. And according to Anthem, 86% of their doctors say that patients who are using wearables are actually more engaged, and better engagement means better outcomes for patients. So we're definitely seeing that as a trend on the way to get data into remote patient monitoring devices. So we think that engagement will reduce hospital costs by 16% over the next 5 years. Voice is a similar story. So voice technology and smart speakers have experienced an adoption curve that's really unprecedented in technology, and it's expected by 2022 that 55% of households will have at least one smart speaker in their home. I think I've got 6 already, so I'm a little bit ahead of the curve. And that's a phenomenal adoption curve, which seems surprising, but frankly it's not. If you interact with a smart speaker, the ease with which you can provide data and provide information is so simple that it makes sense. It's a really easy way to get data into a remote patient monitoring kind of a solution. Additionally, analyzing the speech with tremors and hitches can actually give us information on a patient's actual health. All of these things actually rely on AI to some extent, certainly on the speech analysis, but being able to take a population of data and decide based on the data which patients are more likely to have issues post-discharge allows healthcare systems to create care plans specifically targeted towards people who might have more issues. So at Mobile Health, we're looking at using AI to potentially predict when somebody might have a health condition that results in an emergency like a fall. So all of these are kind of a snapshot into where some of these technologies in healthcare are going. But what about the networks that they rely on? Especially in the home, increasingly devices use cellular as a way to connect to the systems that they're talking to. So how is 5G going to play a role in that? So here to talk a little bit about that are our CTO, Jean Robichaud, and Pete West from Core Wireless. Come on up. Thanks.
Good afternoon, everyone. As Rob mentioned, I'm Jean Robichaud, and this is Pete West from Core Wireless.
Awesome.
We want to spend our brief time here with you today on 5G and how we expect it will impact healthcare.
Thanks, John. And when people think of 5G, I'm pretty sure everyone thinks of what 5G and the bandwidth provides to the consumer, which, don't get me wrong, that's an incredibly important factor when it comes to IoT applications, but specifically industries like healthcare. And as a company that's in the business of helping other businesses really understand how to leverage the 5G networks and this new technology, when we talk to our customers, we take a bit of a more behind-the-scenes perspective. And we work closely with our customers to help them understand how to leverage and incorporate this technology to grow their organizations, but ultimately to give patients a better user experience.
And if you're in the business of healthcare delivery, there are several factors that are critical right now. First one, the whole space is in the process of moving to a fee-for-value reimbursement structure where one of the main components for the measure of value is patient satisfaction. Second, those reimbursement structures are embracing the use of technologies such as remote patient monitoring. And third, providers are finding themselves in a place where they have to compete for patients, and patients are demanding to have the ability to manage their healthcare similar to how they manage their banking. All of these elements can be benefited from 5G technologies.
And those are very good points. And there's an additional added sort of component to creating this massive 5G pipe. It's going to allow for a true back and forth flow of communication between healthcare providers and the patients, where today that communication is a bit limited, but by expanding and adding this throughput, you're going to really start to be able to leverage the known benefits of remote patient monitoring solutions and programs, and really building upon the success of these programs and also creating better platforms. So to improve patient monitoring, it's going to create a network that's going to have this big fat pipe, as we call it, that allows for real-time, high-quality video. And what that'll do, that'll allow healthcare providers to extend programs that will require heavy type data usage requirements and ultimately give accessibility to the greater population. So for example, a nurse can quickly intervene to a case of CHF where a patient may have had a dramatic weight increase overnight, and we could quickly intervene remotely and prevent a catastrophic event and a very expensive emergency visit.
And beyond remote patient monitoring, our capabilities dependent on the use of artificial intelligence, and that's a recurring theme. So imagine not only being able to intervene in that CHS person's care, but also have the ability to use predictive methods to determine if that patient is at a higher risk for additional complications. We could develop more comprehensive care plans for that patient and their healthcare teams. Along with AI, 5G will allow for the very real explorations of treatments and services using augmented reality and virtual reality, which up to now have been used in very limited cases. All those technologies are poised to explode under 5G and have a dramatic effect on pain and stress management use cases, as well as in medical training and surgical preparations. All that stands to All that stands to positively impact patient satisfaction rates and better outcomes, and also allows providers to capitalize on those reimbursement structures.
Right. So how does Core help healthcare companies implement 5G? Primarily, we act as an enabler. We help companies with migration strategies off the legacy networks, all these technologies that are sunsetting 2G, 3G, newer technologies like 5G. And we act as a trusted advisor to really help navigate through the complexities of IoT and hold their hand through the entire process and the full journey.
And 5G networks will allow healthcare systems to improve the quality of care and the patient experience as well as reduce the overall cost of care. All this was, to allow providers to basically compete in the new world that they are now part of. And here to tell you a little bit more of what that looks like and how we can use data analytics to refine how these technologies, how technology is used and implemented are Chris Otto from our healthcare division and Angelica Brunke from Versatile Meta Analytics.
Good afternoon, everyone. As John mentioned, my name is Chris Otto, and I lead the company's healthcare team, known as ClearArch Health. And with me today is Angelica Brunke from Versatile Med, and we'll be wrapping things up today, talking about some of the technologies that we've been discussing and how we can apply data analytics and apply those to some practical, real use cases.
That's right, and as John mentioned, healthcare is undergoing tremendous change right now as we're moving from a volume-based to a value-based reimbursement structure. Our providers are under tremendous pressure to provide value-focused care and better outcomes for their patients. And today we've heard a lot about how digital technologies are going to enable us to do just that. But the real value in those technologies lies in the increased amount and access that we have to data. Big data, as we've been calling it for years now. But the data is just that. We're collecting so much data now that we need a way to collect all of that data and turn it into smart data so that we can paint a picture of not only patient health, but we can zero in on patient behaviors.
And that's really the heart of the issue. We work with healthcare providers all day, every day, and I can tell you one thing for certain, they don't want all your Fitbit data. However, we can take that data and we can process it and deliver it back to your physician or your nurse in a way that is interesting to them. And we can do that by adapting our existing remote patient monitoring application that we're already using today. And by that I mean that we can aggregate data from a population of patients that are using devices, and we can, we can identify parameters that are of interest to your clinical team so that we can filter that patient data, identify the patients that require attention, and in that way we enable providers to manage their population by exception. For example, let's say you have, suppose a practice has 400 patients that's using a Fitbit activity tracker, and we can identify the patients in that group that might not have met a step goal for the week, or perhaps they haven't met their activity goal for the month, and that offers an opportunity for a health coach to call them and try to get them re-engaged and back on plan. Similarly, we can identify clinical concerns such as an elevated resting heart rate that might warrant a visit to the office or potentially a change in medication. The bottom line is that we can leverage proven methodologies that we're already using today for remote patient monitoring and apply that to a broader bring your own device context. Whether it's a wearable activity tracker or a smart speaker in the patient's home or a traditional blood pressure monitor. With the right technology in place, we can harness that data, utilize it, and deliver it to a clinical team in a meaningful and actionable way.
And then with access to that more extensive data set, we can layer in additional levels of analytics into the equation to really get at the health going on behind the readings. We can see what's working and what isn't, and we can better assess the care plan and see where it's succeeding and failing in ways that might not be easily seen or discernible at first glance. For example, we can better assess the impact to medication and nutritional changes. If we have multiple levels of patient data where we can weave together things like vital signs, activity levels, caffeine and water intake, and even sleep levels. So we can combine all of this data and create truly actionable aspects to care management that we've never been able to do before, really creating that full picture of patient health for patients and their caregivers.
And as reimbursement structures continue to evolve, fueling adoption of these technologies by both providers and patients, it becomes increasingly more important that we have a good data analytics plan in place. And for providers, we don't want to just push a bunch of data their way. We want to give them the tools to more effectively and efficiently manage a patient population through enhanced care plans. For patients, we want to empower them to self-manage their own chronic condition or give them the tools to allow them to age in place at home so they can truly manage their own prognosis or even change that prognosis. And for caregivers, both professional and casual caregivers, we want to support them in the work they do every day and give them the right data, not big data, at the right time to help improve the care that they provide. And at the end of the day, that's what we're passionate about. That's what we're doing right now. Delivering technology that seamlessly fits into our lives, combined with the data structures to truly impact how we care for ourselves and care for others. Thank you for your time today. It's a pleasure.